Hello, everyone. My name is Anne Clement, Global Marketing Communications Director at GE Healthcare. Thanks for attending today's webinar, Pursuing Health Equity in Breast Care. Before we begin, I want to cover a few housekeeping items regarding to the platform we're using today. The webinar is being streamed live, so volume can be adjusted directly from the speaker control panel on your computer. You also have the possibility to expand your slide area and maximize it to full screen by clicking on the arrows in the top right corner. Alternatively, you can increase the size of the speaker screen by clicking on a box in the top right corner as well. At the bottom of the screen, you'll also find a menu bar that includes widgets from left to right for the media player to slides, Q&A, help, resources, speaker bios, and such. Please be sure to use the Q&A for any questions and answers throughout the entire session. We welcome your questions. You can also simplify your screen by clicking on the different widgets on the menu bar in order to add or remove the media player, the slides, and any other resources available. Depending on the size of your screen, for some items, including the resources, you may need to scroll to the left or to the right to see all the content on the menu bar. In addition, I'm sure many of you will ask questions throughout the webinar, so again, feel free to click on the Q&A widget and submit those questions. And again, don't hesitate. We'd love to hear from you. And finally, we'll have an on-demand version of the webcast that will be available shortly after we close the webinar. That will be accessible using the same audience link that was sent to you earlier. Now, it is with great pleasure that I introduce our moderator, Agnes Berzsenyi, President and CEO of GE Healthcare's Women's Health and X-ray business. Over to you, Agnes. Thank you.
Thank you, Anne, and thank you all so much for joining us today. Again, my name is Agnes Berzsenyi, and I'm the President and CEO of the Women's Health and X-ray business at GE Healthcare. I'm really excited to host today's discussion on a topic very important to me with regard to what we can do together as a radiology community to help bridge the gap when it comes to pursuing health equity. The title of our conversation today is Pursuing Health Equity in Breast Health. Health equity is truly a commitment. It's a commitment to reduce and also ultimately eliminate disparities in health and also in its determinants, including social determinants. Pursuing health equity means striving for the highest possible standard of health for all people, giving special attention to the needs of those at greatest risk. But health equity can mean a lot of things to many people. For some, it's about access. For others, it's about providing patients with the technology and resources necessary to get the care they all need and deserve. And in other cases, we can consider health equity to be about sharing scientific innovation across the globe or to facilities that are not able to always have the cutting edge in technologies and in innovation. These disparities are not unique to breast health, but with Breast Cancer Awareness Month on the horizon, and as we celebrate our very own Sonograph Pristina, our milestone of 5 years of Pristina mammography innovation, for today's discussion, we want to dig into what can be done to help eliminate these disparities in overall care, but especially in breast care. In our session today, our goal is to share how our speakers and their organizations are working together to improve awareness within their organization, within their communities, and also across the industry. So let's get started by introducing our panelists. First, I'm very honored to introduce Dr. Sonali Johnson. Dr. Sonali Johnson is Head of Knowledge, Advocacy, and Policy at the Union for International Cancer Control. Her main area of work is to ensure that cancer prevention, treatment, and care is positioned within the global health and development agenda, including plans for universal health coverage. Sonali, thank you so much for joining us today. Could you please share more about the work you do and why you're passionate about access and also equity in healthcare?
Thank you so much for inviting me to this really important discussion. So I've worked on aspects of equity in healthcare really pretty much my entire career in public health. I started working on gender equity and in relation to HIV/AIDS. And I've been working at the UICC for the past 8 years. I started actually working on childhood cancer, where there's a lot of inequity. And now my portfolio includes also women's cancer, so cervical cancer and breast cancer. So, you know, I'm a social scientist by training. So really the issues around access to healthcare, health and illness, understanding what people do when they're sick or what people do when they're well is really something that I enjoy studying, but also the systems around healthcare. So for those of you who don't know the Union for International Cancer Control, we're one of the oldest and biggest international cancer organizations, and we were founded in 1933. We're a membership organization made up of our members are hospitals, patient groups, cancer societies, universities, research institutes, and even ministries of health. We have over 1,100 members in 171 countries. So for our members, equity is a big concern, and this comes out, you know, in survey after survey that we do, and in our phone calls and meetings with them. You know, cancer is a disease that's really characterized by inequality, and there are huge disparities around the world in the ability of people to access cancer information and prevention services, but also early diagnosis, treatment, and care. Pain medicines, palliative care is also another big problem. And for many people with potentially curable cancers, you know, cervical cancer, breast cancer, even childhood cancer, you know, diagnosis and treatment occurs very late, if at all. Today, we're talking about breast cancer, and there are some really striking inequalities. You know, breast cancer 5-year survival probabilities, you know, are over 90% in high-income countries. But, you know, as a Lancet study has shown with different countries, that it falls to 66% in some countries, including India, and even lower in others, 40%, for example, in South Africa. And these reasons for these differences are really multifactorial.